Greetings. Hi, my name is Sutedja Karuniaputri with Rila Students number 235. Thank you for the opportunity for starting our small group discussion of B1 topics about good quality of life at the end of life care. Next, here's the 13 total members of B1. Now we're moving on into chapter 1, introduction. Both life and death having their own journey. In the first place, having a good quality life as countdown before death never became a truly issue in life. Before WHO raised the awareness of quality of life after the end of World War II. In order to achieve that, measure of adequate end-of-life care is the proportion of patients dying at home compared to the proportion of patients dying in hospital, which means it has indicators of like performance requirements, whereas there's so many aspects of life must be considered when evaluating the quality of life someone, especially the good one. Making sure they accept their dying also within the surroundings is essential to ensuring they have a good quality of life at the end of life care.
My name is Zephania Ekklesia, and the last two digits of my student ID number is 127. The problem formulation of our student project, the first one is what is the definition of good quality of life at the end of life care? Second, what is the domain of good quality of life at the end of life care? Third, what is the economical aspect of end of life care? Fourth, what is the ethical aspect of end of life care? And the last one is what is the problems and solutions on health services towards end of life care? The objectives is to understand the definition of good quality of life at the end of life care, to understand the domain of good quality of life at the end of life care, to understand the economical aspect of end of life care, to understand the ethical aspect of end of life care, and to understand the problems and solutions on health service towards end of life care. The benefit of writing this literature review is to give information about good quality of life at the end of life care and to study and understand more about the good quality of life at the end of life care.
Hello, my name is David Christopher Chandra with the name 066. I would like to explain about the chapter 2 for the first one, which is the definition of good quality of life at the end of life care. End of life care is an important component of the healthcare system, which provides comfort, dignity, and also medical support to patients with a critical and terminal conditions of disease. End of life care strives to mitigate and alleviate distress, promoting optimal quality of life for both patients and their families without being too focused on on the patient's disease stage or other treatment. Focus on the holistic well-being such as medical aspects, patients and family cognitive, emotional, and also social condition. A good end of life care can increase patients' quality of life during their time surrounding death. So, quality of life is a form of people's perception and also satisfaction about their life, and it is very related to local culture and customs, and then being compared to their goals, expectations, and also motivations. It determines how someone navigates their life and also achieve their life goals. People with a good quality of life tend to have high levels of productivity, competence, and also a desire for a progress. The goal of the end of life care is to increase patients' quality of life. That can be seen from the patient's conditions, such as physical comfort, emotional well being, spiritual fulfillment, and others based on the domains.
Thank you for the opportunity. My name is Geg Mas Anantalakshmi with the last digit of new member 001. Today, I will explain about the domain of quality of life at the end of life care. Goals of care change as disease curing treatment become ineffective. Prioritizing the quality of life is more important than trying to find a cure. It is estimated that there are more than 20 million people that need different kind of end-of-life care. From interview with patients, singer and colleague found 5 domains of end-of-life quality care. The first one is receiving adequate pain and symptoms management. End-of-life patients discuss pain frequently. By treating pain and symptoms, healthcare provider can improve patient quality of life. To effectively manage pain, a healthcare provider should do an in-depth exam. Then, the healthcare provider and patient can create a joint treatment plan. The next topic will be explained by my colleague.
Hello, my name is Pande Karina Candra with my last student digit number R240, and now I'll present you about the topic avoiding inappropriate prolongation and acceleration of dying. Healthcare providers will focus on providing patient-centered care that considers the patient values, preferences, and goals of care. This can be achieved through effective communication with the patient and their family, shared decision making, and the use of advanced care planning. By avoiding inappropriate prolongation and acceleration of dying, healthcare providers can ensure the patient receive care that is aligned with their goals and value, and they are able to die with dignity and comfort. This approach is beneficial for improving care outcome and reducing care expenditure. Thank you.
Next, I will explain about achieving a sense of control. But before that, let me introduce myself. My name is Putu Indriati with last three-digit number 231. Control is to order, limit, or rule something or someone, action, or behavior. Sense of control means how much control someone feels over their own life. There are four themes that constitute a complete of balance of the sense of control. Number one is direct communication, means the patient is able to indicate what treatment was or was not desirable to feel the patient decision were under control. Third-party analogies describe the patient to express priorities and principles they expect could guide the caregivers. Adaptive denial focus on supporting the patient to keep away from worrying aspect of regard morality and prepare for future needs. Last, engage avoidance relates to a condition where the patient focus on the positive things and left the decision of his or her end of life to the hand of others.
Hello, my name is Marta. I'm a student of student number 8064. Now I'll talk about reliving burden as one of the five domains of life and quality of care. Patients often feel like a burden due to dependency and the need for physical assistance, which contributes to feelings of burden. Many patients also feel that they are the cause of financial difficulties. This certainly affects the way they see themselves, their self-esteem, and their assessment of situations. Apart from the patient, the burden also lies on the caregiver. Caregiver burden can be based on various aspects of the care situation, such as lack of recovery time, challenging behavior of the person requiring care, and limitations in social activities. Interventions that can be provided in this regard are first, providing education related to pain management or training in pain management skills. Second, supporting patient autonomy, which is considered an important principle of end-of-life care. Third, strengthening the sense that the patient's value is intact. Fourth, avoiding condescending attitudes. Fifth, facilitating communication between the patient and the family. Sixth, supporting the patient's efforts to care for themselves. And the last is minimizing patient disability. That's all from me. Thank you.
Hello, my name is Sabrina, and I will continue explanation. It's about strengthening the relationship with the loved ones. So, current approaches to bioethics perhaps underestimate the importance of social and family relationships. Facing death in the context of loved ones can be an important redemptive relations. People live in a network of social relationships and are often afraid of dying alone. Patients often want to reduce the physical and mental burden on their loved ones. Added to this desire is the patients need to seek the active participation of their loved ones to overcome feelings of isolation. They also want loved ones to remain connected to them during the dying process. The tendency of professional caregivers to focus on the management of acute illness and often rigid hospital regulations can pose barriers to full the active family participation and other loved one in caring for dying patient. Thank you.
Hello, my name is Gusti Agung Saraswati. My last is number 056. Now I will explain about economic aspect of end-of-life care. End-of-life care includes medical, emotional, and practical support provided to individuals who are nearing the end of life. This treatment can be expensive, including sanitation, hospitalization, and palliative care service. Socioeconomic disparities can have an impact on person abilities. Policymakers need to address the financial challenges surrounding end-of-life care, including expanding insurance coverage, performing cost assignment model, and advocating for equitable access to affordable treatment. That's all for me. Thank you.
Hello, Dr. and friends. My name is Geraldine with the last three digits of student ID is 100, and I'm going to elaborate the aspects of end-of-life care. So, caring for the dying person presents ethical challenges for doctors or physicians requiring the safeguarding of rights, dignity, and fatality during clinical decision making. Care decision points involve resuscitation, ventilation, nutrition, sedation, treatment choices, euthanasia, and assisted suicide. Common end-of-life issues include miscommunication, compromised autonomy, poor symptom management, and shared decision-making difficulties. The principle of autonomy underscores patients' right to self-determination, and it is defended by doctors through proper use of advanced directives or AD. That's all from me. Thank you.
Hello everyone, my name is Natania Sutedja with realized digit of student number 175, and I'm going to explain about problems on health service towards the end of life care. That includes the first one is lack of access to end of life care. This can happen because of addressing an unmet need, differential or complex access, intentional or unintentional differential provision, or cultural belief. And the second one is lack of professionally trained health workers in palliative care. This because most trainees still receive very little training in palliative care, and their proficiency in this area of care is not adequately assessed during license exams, despite the fact that palliative care issues are among the most common difficulties that oncologists face. And the last one is underused palliative care. Palliative care services are available in oncology hospital, although they are frequently underutilized. Expert palliative care is only referred for a small percentage of patients whose symptoms are poorly controlled, and many of these patients are referred only relatively late in the course of their disease after they have been suffering from poorly controlled physical or psychological symptoms for some time. That's all from me. Thank you very much.
Hello everyone, my name is Erick Gonata with 3 digit of my student ID is 096. I will present about the solutions on health service barriers towards end of life care. So we got three main problems here. The first one is how to improve access to the end of life care. So as the general practitioner and the element of the public, we can increase the public awareness and educate people about um, how how important is palliative care and its benefit both for the patients and caregivers. While being a governor, we can create rules and regulations that guarantee the sufficient of resources on palliative care. And in the other hand, we can also increase the accessibility and availability of palliative care in all of our health facility, such as the hospice, hospital, community, and home. The second problem that we need to overcome is to address the lack of professionally trained health workers in palliative care. What can we do is including the instruction and develop the curricula for our School of Medicine, such as the medical school, the nursing school, and the other healthcare school, so that all the students that um, go to the medical school will have the requirement of the palliative care programs. In the other hand, we can also provide the professional development program for the professional healthcare so that they can refresh their knowledge in palliative care. The third problem that we need to overcome is to increase the utilization of palliative care service. As the healthcare professional, we can implement the yearly and regular screening and assessment only for the patients with terminal disease. And we can also enhance the communication and cooperation between oncologists and the palliative care specialists to ensure a smooth and coordinated care transition. We can also provide timely and appropriate referral to palliative care services based on the patient's goals of care and prognosis. That's all from me. The presentation will be continued by my colleague. Thank you.
Hi, my name is Caitlin, and my last three-digit number is 138. I'm going to read for the conclusion. For those with terminal illnesses, end-of-life care is essential because it offers medical assistance, comfort, and dignity. In order to provide quality treatment, it is necessary to manage pain, prevent prolongation, gain control, reduce load, and build connections. Because socioeconomic differences might affect access to care, authorities may need to change compensation mechanisms and broaden insurance coverage. By addressing particular issues and requirements, it shortens hospital stays and could even increase survival times. Clinical decision-making raises ethical questions that have an impact on society, patients, families, and healthcare professionals. There are some problems, but also solutions regarding that. Problems include inadequate access, insufficiently skilled healthcare personnel, and insufficient use of palliative care. Meanwhile, enhancing access to end-of-life care, addressing the shortage of medical professionals with training in palliative care, and boosting the use of palliative care services are some of the steps we can take to address those three issues with health services related to end of life. That's all for me. Thank you.